Well, I've been a full board certified plastic surgeon for over 12 years. I come from a family of doctors, including some plastic surgeons, so I got it honestly from my family. It's a long road. I did, including medical school, it was 11 years of training after college. Originally back in school, I really enjoyed doing microsurgery and hand surgery, and so during my training, that's where I geared my interest toward, and in doing so, doing general surgery and then microsurgery and hand surgery. Finally completing with plastic surgery, I got really into all the aspects of what I appreciate as plastic surgery. I was very excited to start my own practice. That was in 1999, and I hit the ground running and did a lot of surgery and never said no to anything. And one thing led to another, and my practice really took off very quickly. In 2000, I did a prominent surgery, first of its kind, and made some news and was on some TV shows, and I think that really contributed to helping start my practice. Mostly what we do here at the Plastic Surgery Center, we have a multifaceted practice, but we have a lot of geared toward doing cosmetic procedures. I have a full-time nurse esthetician who does laser treatments, facials. We have an esthetician that does facials and skincare. We do injections like the Botoxes and the Juvederms and all the things you hear on the news all the time. We have basically a spa here. I also do minor procedures here in the office. So we have a procedure room. And then I, of course, do a full-fledged plastic surgery practice where I do most of my outpatient surgery in my surgery center, which is right behind us. We do everything, a lot of breast surgery, breast reconstructions, breast augmentations, breast reductions, asymmetry surgeries, people with different problems. And then we do all the liposuction, the tummy tucks, and all that kind of stuff too. I would say the majority of our patients, the first contact they have with us is not with telephone, but on the internet. So we're constantly updating and getting our internet, our website refreshed, renewed, and so that is really important to keep a well-informed, easily accessible website. We have experienced, educated people that answer the phone here, and then they will quite often spend a lot of time talking to the prospective patients about their questions that they have. And ultimately, the most important thing is to try to get them in here to meet with me or my staff, mostly me, and find out what they're looking for, answer their questions, inform them on what is the appropriate way to tackle their problem or complaint, and then go from there. We are constantly being inundated with phone calls and questions about the new greatest thing out there. Every 2 or 3 months there seems to be the new thing out there in the news, on TV, or being in the print media. So we are always trying to keep abreast and keep our patients educated on what is the best thing. I'm a board certified plastic surgeon. There's a lot of people out there that aren't plastic surgeons or not even board certified. And we try to educate the patients along with our society, plastic surgery, educating people that is really important to check the qualifications of the doctor. I'm proud that I own and run and are able to accommodate my own practice, including my own office, my own staff, and my own surgery center, which is right behind us. And I think that's an accomplishment to have accomplished in relatively 10 years. I really think we make the patient experience pleasant. I try to emphasize that when they come in to the time they come out, that we're there to serve them, to make them feel better, to make sure that we're trying to address their needs and their complaints.